It's Friday. You're watching Atlanta and Company. I'm Christine Pilar. It's so great to be with you. Wednesday was the official first day of summer. It's the time of year we want our skin looking its best, but if you have unsightly spider veins, you may not feel your best wearing your shorts, your dresses, your swimsuit. I totally understand. Dr. Louis Provosti from Vein Atlanta and Sclerotherapy nurse Susan Reed join us now to tell us how they can help you. We want you looking and feeling confident, sexy, beautiful this summer, and men too. Men have varicose vein issues and spider vein issues. So thank you both for being here. We appreciate it.
Well, thank you for having us.
Susan, I'm going to start with you. You've been a nurse for 32 years. Tell us a little bit about yourself.
I have done lots of different things in my career. I've done ICU. I've taken care of babies and moms, and my focus now is on veins. And absolutely love seeing people get happy when their legs are cleared and beautiful.
We'll talk about sclerotherapy. It's been around for a while, right? And it is so effective for treating the varicose veins and spider veins, right?
It absolutely is. We use a substance called polydocanol, and it's wonderful. We put it in your legs. It's a small injection, has an anesthetic in it, so it doesn't hurt very much. And it just has the most fabulous results.
Oh, I'm watching the video right now. Okay. Listen, it's no secret. I get a little Botox every now and then. Does it feel like that? Because it's true, guys. I'm 43. Work with me. Work with me. Does it feel okay? It feels like that little pinch, like a Botox. You know,
I've never had Botox, but I will tell you, it's just a, it's a tiny little stick.
Okay.
It does not hurt. I tell people that
I can handle.
Yeah, you can handle it.
Okay.
A mosquito bite. That's probably the worst thing I could relate it to.
Okay, that's
wonderful.
Nothing.
It's not bad.
And tell me about how the sessions, I know you can't really say everyone needs only X amount of sessions because everybody's different, right? So give me a general idea.
It's very individualized. If you come and you have several veins, it's obviously going to take more sessions. If you just have a few like you do.
Okay.
Dr. Provosti, she was showing us.
Flashing them in the break. I'm like, help me, doctor. Well,
we can do that in 5
cute
minutes.
Or scary, right, crew? And they're like, put your dress down. So it depends.
You're adorable.
It depends. I might have maybe one or two for me.
Right. It's so individualized. It depends on what you have going on and if you have venous reflux disease and just so many variables.
Okay.
But Christina, a typical session would be 15 minutes.
Oh, that's great.
To give you an idea.
Okay. Any downtime?
No.
No.
We do ask for the first couple days no intense physical activity or like a hot tub or a sauna, something that would cause the veins to dilate. But we encourage walking immediately. Normal driving, normal activities are fine.
Okay, and doctor, it seems like spider veins, from what you've told me before when you've come on the show, are just the tip of the iceberg when it comes to venous disease.
Yes.
So tell me more about that.
Sure. What spider veins are tiny little veins that are normally under the skin that are invisible, but they become a spider vein when they get backed up with blood. And that backing up of blood is due to a problem called chronic venous insufficiency. And that is sort of, you know, if the spider vein is the tip of the iceberg, the chronic venous insufficiency is the 9/10 of the iceberg of the problem that's under the surface of the skin. And we use specialized ultrasound equipment to identify that. And of course, we treat that as well.
Okay, and I think last time you were on, you brought the big piece of equipment to show us with your patient.
Right.
You know, is this just a spider vein issue or does it go deeper? And you were able to analyze that and help your patient, so it's wonderful.
Sometimes we have patients that will come in and they'll say, well, I've had spider vein before treatment somewhere else and it didn't work, or they came back. And usually that's a sign that there is a deeper problem.
Okay.
And an ultrasound might identify this chronic venous insufficiency, and if we get that treated first, and then we do the sclerotherapy, they have a much better results.
Okay.
Right.
Yeah, my poor mom, she's coming to Atlanta. I'm going to have her come see you because she's got it terrible. And it's hereditary. We've talked about that typically, right?
Yes, it is.
Okay.
That's correct. If you have one parent that has vein problem, you have a 50% chance. If you have two parents, you have an 80 to 90% problem.
So you want to get on it right away, as soon as you can.
You do.
And what you're seeing great results. I know we showed the video. It's that simple. You just stick the solution in.
And that's it.
And that's it.
That's it. It really is that easy. And the results are wonderful. People have just been so happy.
Wow, look at that. That's beautiful.
They can wear their shorts again. I can't tell you how many patients I've had come in that say they can't wear shorts, they can't wear dresses, and after our treatments, they're back to normal.
Right.
It's a good thing.
It really is a good thing. Oh, and speaking of that, should we, I mean, we're in the middle of summer. Is it okay to do it now, or should we wait to winter when we're in our pants and turtlenecks and more bundled up?
It's up to the patient. I mean, sometimes they're of the mindset, it's on my mind, I want to get it done, let's get it done. Most of the time we're in air-conditioned spaces anyway.
Right, but I mean, like any bruising, you know, I guess it again depends on the person,
It depends on the person.
Okay.
You can get some bruising. Sometimes the veins can look a little bit darker for a couple of weeks before they lighten up.
Okay.
And we do ask that the patients wear compression stockings.
Okay.
But it's really up to the individual whether they want to wait or they want to start.
Yeah, I can handle a little bit of bruising. I don't want to handle these anymore though. So yeah, and in my case, let's say just from what I showed you, it might be a case where I bruise a little bit, but that's it.
And
right?
you may not.
And I may not.
You may
even.
not
Okay.
bruise.
I love that.
And there's a plant extract called arnica.
Oh yeah.
And that can be applied to the surface, and we have that at the office, and that helps reduce bruising as well.
Okay, fantastic.
So.
And every time you come on the show, you have a great offer for Atlanta and Company viewers. We always appreciate it, so tell us about that.
Susan, what is it?
Take it away, Susan.
I do believe we're doing a 20% discount
Wonderful.
for anybody who calls.
Today.
Okay.
They call today.
Book an appointment by the end of the day, guys, and you can receive 20% off a sclerotherapy session. Look great in your shorts, your sundresses, on vacation. Do it now for so many reasons, not just cosmetic, but for the health of your veins.
Absolutely.
So thank you. It's always a pleasure to see you and nice to meet you.
Thank you.
Appreciate
Thank you
it.
so much for
Christina.
having us.
Sure. And don't forget, you have until the end of the day to book an appointment for 20% off a sclerotherapy session. For more information about Vein Atlanta, give them a call at 404-446-2800 or visit their website at veinatlanta.com.